All right. Hi, everybody. Welcome to a really special night tonight. I'm so excited to have the chance to host this. I know it says Kelly Hoover on the screen, but my name is Sarah Cole, and I'm so excited and have really big shoes to fill. Hosting the Zoom tonight for healthcare professionals and just talking about the partnership that you can have with the incredible telehealth company that all of us are partnered with, LEMD. So just to kick off really quick, I'm going to share my quick background, talk a little bit briefly about LEMD and how it works. But then the big highlight of this Zoom tonight is really hearing from our three guests. And you guys are really in for a treat, hearing from three incredible women, all in the medical field, and also business owners as well, alongside this partnership with LEMD as well. So again, my name is Sarah. I have a background in anesthesia. I've been a nurse anesthetist now for, gosh, like 12 plus years. I was ICU nurse before that. Right now, I'm still working in the hospital. I do in-house 24-hour call shifts. I also work at an IVF clinic. I get out of breath easily because I'm also 21 weeks pregnant. Okay, so bear with me. And I also have done, big open heart surgeries. I used to be the heart team leader. I've done lots of different things in anesthesia, and through all of my work, I've really gotten to a place in my practice where you see so much chronic disease. You see so many people ending up on my operating room table, right, where I'm giving the anesthesia, whether it's for a vascular surgery, joint surgery, open heart surgery, from preventable disease. And it starts to wear on you. And I started learning about peptides, GLP-1 medications. I saw a transformation of a friend of mine who introduced me to them. I myself was going through many, many years of IVF and infertility. This pregnancy is like an absolute miracle. It was from we had 7 years of failed IVF rounds, miscarriages, and now I'm pregnant at 42 years old. And I think a lot of that has to do with my peptide journey, the inflammation, anti-inflammation that comes with it. And then also, oh my gosh, our waiting room is filling up, you guys. I'm letting everyone in as I talk. The inflammation, and I also did NAD as well. That has a lot of proven results with egg quality too. So I'm not going to go through all that, but LEMD came onto my lap, and what it is a concierge telehealth company in the regenerative health space that specializes in longevity. So we have all different types of longevity medications. We also have weight loss with GLP-1s. And it's a really simple process for people. You can work as a brand partner with the company, but the customer experience has been really seamless. I think nowadays telehealth is really emerging, making it more accessible for people. And that's really the backbone of why the company was developed is the goal was to make it more affordable and more accessible for more people. And what happens is you go to the website, we have a health assessment form that gets filled out, goes through your medical history, and then we have a team of board certified providers that review that health history in a visit. They send that to one of our partnering 503A compounding pharmacies. Everything is NABP accredited and goes through rigorous testing, purity testing, safety testing, so you can really feel good about it too. And then that prescription gets filled and gets sent directly to the client or the patient too. So it's really great how they figured out there's an entire patient portal where you can log in, you get direct access to your doctor, and then you get ongoing support from the brand partners from our community too. So without further ado, that's kind of the quick rundown there. But I really do want to start introducing some of our speakers tonight. And first off, I wanted to introduce Dr. Angela. Is it Ram? Is that how I say it? Did I say it right?
Yes, you did.
Yay! Okay, good. And I'm just meeting a lot of these ladies too, and I'm so excited. But Angela is really amazing. She's a licensed naturopathic doctor for 15 years. She co-owns two wellness and weight loss centers. Okay, but that's not all. She also has owned three franchises in for Subway, right? Subway, Papa Murphy's, Fantastic Sam's. I love that. My husband just started in the franchise world as well about 3 years ago. So I've been helping him with that, and it's been amazing and so much to learn from. And he looks at LEMD and just sees how brilliant it is from a business perspective too. So Angela, I'm going to go ahead and let you take it away.
All right. Thank you. And congratulations on your pregnancy.
Thank you.
All right. So, first, I'll be 60 next week. And truly, for me, it's been a lifetime of dieting. I'm sure some of you can relate. It's been a constant loop of, what to eat, what not to eat, counting macros, the whole thing. We've tried it all, losing and gaining, just kind of that roller coaster. And think of it, I've been doing this since fifth grade. So, it has been a long time for me. And about 15 years ago, when I stepped into the whole holistic side of healthcare, it completely shifted my entire mindset around health. I did a complete 180. I went from, and those of you on the call who know me, you'll laugh, but I went from party girl to green juice queen. I went from juicing everything and everything being organic to loading up on supplements. I mean, I still have supplements probably from 10 years ago in my pantry. And truly, I was convinced that if I found the right combination of supplements, I could fix anyone of anything and naturally, right? And back then, peptides weren't really even a part of the conversation. I mean, nobody, unless you were in like underground, peptide world in the fitness world or something, no one knew about them. And it was probably, I would say, about 5 years ago, I discovered a couple growth hormone peptides and some healing peptides, but nothing on like weight loss. I would have been all over that. But unlike now, truly, there were no regulations, there was no guidance, there was no safe sourcing or dosing. No one knew. It truly was like the Wild West. And though I saw kind of huge potential in this, I just ethically I couldn't like share it with patients. It really wouldn't have been right because I really didn't even know what I was doing. And then, come the GLPs, the magic shot. Instead of the magic pill, it was the magic shot. And when this was trending, I and my business partner, we were skeptics. I mean, we were poo-pooing this. We brushed it off as, simply, yeah, okay, don't worry about your diet, just go ahead and eat whatever you want and that's it. And that's kind of what the headlines were saying, right? And then it was all the bad stuff we were hearing about. But shame on us, we were not looking at really the true science and the research. And then we heard about microdosing and how GLPs affect brain health, cravings, and the whole metabolic repair. And we know how important that is and how hard it is. And that's kind of when everything changed. That was at the beginning of this year. And we realized this just isn't about weight loss. It was a completely new category of healing. And let's just say we were all in. And then in the spring, when the FDA cracked down on compounding tirzepatide and semaglutide, talk about being late to the party, we knew we needed a backup plan because we didn't know what the future held for us. And we knew we needed something legal, reliable, safe. And that's when I was in Egypt and my business partner like found LEMD for us. It was kind of crazy. And when I got back, we saw that this was kind of really purely practical, like this was a good thing. But we didn't jump really all in. But what we really didn't expect through the first few months is how professional LEMD is. The education. I learned something every week, and I listen to podcasts and everything for, hours, even in a day. And so with the vision of Ellie, we knew we had high quality peptides that we had access to, and we could support a lot of people who were calling us and asking us things across the country. And then I got paid. And so as a healthcare provider, I'm sure some of you can relate, we don't typically lead with money or think about money. But then my husband looked what I got paid last month and said, why aren't you telling everybody about this? And that's kind of when it clicked for me that this just wasn't clinical solution. It was actually a smart business decision. And so it aligned with, my passion and the impact that we could have, a new income stream. And, I could do what I love without kind of having that burnout. And that's what I really appreciate is, Ellie's really good about all of the things that I mentioned. And they also don't just help the licensed doctor. They really empower the people who are educated, the ones that are hardworking health coaches and wellness professionals, and even just the health enthusiasts. So I'm truly grateful to be part of this. And thanks for having me on tonight.
So good. And thank you so much for sharing that perspective too. I think I had that aha moment as well where I'm like, why am I not leaning into this more? It's such a natural, you get asked about it all the time. Okay, so next up, I'm so excited to introduce Annette. She is a nurse practitioner, busy mom of three kiddos, balancing it all. Excited to hear from her. So Annette, I'll let you go ahead.
Sounds good. Thank you, Sarah. Um, and great, Angela. That was really interesting. And my name's Annette Meyer. So I've been a nurse practitioner for many years, experience in critical care, cardiac surgery, and then for the last 9 years, I've been doing house calls for Medicare patients. So when I was introduced to LEMD, I really loved the concept, and I love the health and wellness. I always, obviously, I see a lot of chronic, and so I've been dealing with that for many, many years. And so it was like a no-brainer. I'm like, oh my God. I mean, we need to get to um, this before they get to what I see, like on a daily basis. So after doing my research, um, I found that LAMD was a very reputable, had a very reputable telehealth platform, and they offered therapeutic peptides like weight loss and other peptides. And I've seen a lot of peptides, obviously, in my field and the patients that I talk to and educate. And now I'm seeing it more and more used by the doctors, cardiologists, kidney doctors. I mean, so many more doctors are using it, not just for type 2 diabetes. I'm talking about the GLP ones, of course. They're using it for so many other things. So, I mean, big change from like 9 years ago when I started with house calls. I mean, huge impact that I've seen in my members, not only losing the weight, but just feeling better and just so many different levels. And love the affiliate plus model platform that LEMD has. You earn a commission on the patients that you know, have them go on your website. And what I really like more is like the burden of not having to prescribe and no overhead. And so all those things are just really, really key because I use this as a second stream of income. So, I do the house calls, and so I use this, as a you know great way to make a second stream of income, and I'm learning so much. The community and LEMD is more, I feel like, is more of a community of so many different affiliates, not only healthcare affiliates, but all different backgrounds. And they have the education every week. And I'm learning so much. And, with my expertise in chronic care, I really make an impact on how uh, help people, how they to do better for themselves in prevention. So, I mean, this is great for like healthcare providers and other providers looking to expand their impact and income in both wellness and longevity. So I've learned so much through this peptide or longevity journey. So, and then I myself have tried the peptides as well. I've tried like 5 or 6 different peptides because I felt the impact on myself, midlife impact, with perimenopausal and just brain fog and all these things. So I've tried a lot of the peptides and I feel amazing. And I've always been into like health and wellness, even throughout the years. So, mhm. So let me stop talking now.
That was so great, Annette. And yeah, I found myself too. It's like you take care of so many patients with so much
Mhm.
chronic disease that could be prevented, right?
Right,
And just finally having a tool for people that's really working
right.
too. I read an article, it was months ago actually, but it was in Becker's Hospital Review. I can drop it in this chat box too,
Okay.
but they literally were talking about how these medications are transforming patient care to the point that it's altering surgery volumes in the future, where they're anticipating there's going to be less joint procedures, there's going to be less open heart, less
Right,
vascular because of these medications, which I think is pretty profound. I'm like,
right.
great. If I don't need to do as much anesthesia because people are needing their heart surgeries and needing their joint replacements,
Right,
that is fine by me, because it's so much better for the patient. So
right.
really, really cool. So next up, I'm excited to introduce Megan. She's an aesthetic nurse injector, and she also owns Beauty Lab Aesthetics as well. So, so excited to hear from you, Megan.
Hi, good evening. Thank you for having me tonight. So yes, I'm a registered nurse specializing in aesthetic medicine. Also own my own aesthetic practice here in Southwest Oklahoma. So I was first introduced to GLPs back probably 3.5 years ago, and fell in love. And I've noticed a shift in my industry, specifically, really going towards regenerative and just overall wellness. And so currently in my practice, I do offer GLP, um, but I'm seeing that time management and schedule optimization gets difficult because I'm seeing them every 4 weeks in clinic for a follow up prescription pickup. And so if other healthcare providers, that can be time demanding. And with LEMD, it's allowed me to open up my schedule for other services. Um, and not to mention, documentation takes a long time, sourcing, especially with all the FDA changes, sourcing pharmacies, prescription management, and overhead. That's a lot. And if you're anything like me, you're a one woman or a one man show. So time is of essence for me. Time is money. But like I said, I was only offering GLP-1, not any other peptide therapies. And so that's what I love about LEMD is I'm able to offer, other peptides to my clients. And I love that you can kind of customize it because, you know, although I may not see them in office, I can still have a virtual conversation with them and get them going, get them set up. I still, want to check in with them. I want them to still feel like they're getting patient care and getting a service. And I feel like they love that. And it also allows for another touch point, to open up other opportunities for other services that you may offer in your practice. They may not be coming to you, for instance, aesthetic services, but when they learn that, then it may turn into another, potential, revenue. So yeah, and not to mention it's meant to be. My oldest daughter's name's Ellie, so I had to.
I love that. I love that. And two, I think it's such a great add-on. If you are any sort of, aesthetic practice owner, anything like that, where you've been wanting to venture into peptide therapy for your patients and to take that on, it's, the overhead, hiring a lawyer, make sure that everything is up to snuff, also making sure your partnerships with compounding pharmacies are good. One nice thing that I really love about LEMD is because it's such a huge, it's a big company now. It's growing, it's nationwide. They have these contracts with different compounding pharmacies and move a lot of peptides. So because they do that and have, they work with some of the top compounding pharmacies, most reputable, and they're able to get some of the best pricing because of how many peptides we're also selling too. So as far as getting great pricing, when you do have a smaller practice, you're maybe not able to get some of those partnerships as well and get that best pricing for your patients too. So that's just an added bonus. One thing I did want to talk about too, just about, one of the frequently asked questions is, okay, how does this like affiliate plus model work? Like, how does it work to be a brand partner with the company? And truly from like a legal standpoint, as a brand partner, you are a professional pointer. Okay. You're not acting as a provider. I am not using my nurse anesthetist license in any way when I'm working with LEMD. I am truly referring anyone that uses my link to their doctor team right through the patient portal, whether it comes to management, changing their dose, support with side effects, which honestly, I've not had almost anyone with major side effects with it. So really it's kind of hands off from that perspective. One of the questions was more about how you can use this within your current work. When you own your own practice, you are the boss, and I can see it implemented much more. I personally don't use it within my personal anesthesia work, but I also have such a big network just in my personal network, whether that's friends, family. We do have a lot of support when it comes to learning how to share this on social media as well, where you are like there for education purposes, right? To educate on what these are. And many times people are like, okay, I've been hearing about this. I've been wanting to learn more about peptide therapy. Where can I get it? Where can I get it from a safe, reputable place? You're able
Mhm.
to point them to LEMD and to your personalized link. Annette, Megan, Angela, do you have anything else to add with that, or any other questions you've gotten from people that you wanted to address?
I just want to say that as well as, we're pointing the patients to these peptides, we are there for them too, for any questions that they have, we're like their, the support system through their journey of longevity. And that I mean, we do that already in our field of nursing and or being a doctor. So this is such a nice kind of way to kind of, also be their kind of liaison to helping them through their healthcare journey and stuff like that with peptides. So
I also think that, it's not just healthcare. I know we have a lot of healthcare, but fitness trainers. I mean,
Yeah.
we have so many people who are in this vicious cycle. They can't drop 5 pounds to save their lives, and they're working out like crazy people in the gym. They're fasting. Their body just can't operate the way it's supposed to. And the education calls that we have, sometimes on Monday nights, there's some great
Oh, yeah.
too, but Thursday nights for sure, you will get blown away at the information. I mean, it's 101 of peptides often, but it expands in that hour, the power of peptides. So, and then Thursday nights are great. I'd highly recommend, if you're interested in this, make sure you tap into those calls.
Yes, the education series are so good. You can look up LEMD on YouTube too, and you will see all the replays, and you can listen to them like a podcast, right from YouTube too. Those are really great. Megan, did you have anything to add?
I don't think so. I think everybody kind of touched on everything. I think it's great. It's like I said, time management is huge for me, and it's kind of alleviated that. But again, like I think you can do a lot with it. Like I said, you can customize however you want to, you know, how much communication you want to have with that patient. And I do love, you know, I have allowed some of my patients to come in that, they maybe want a little hand holding,
Yep.
but LEMD makes it so easy, like with their dose, it's not like this many units and then this many units. Um, at first I had a panic moment. I was like, oh, 50 units for with their own weight loss, 50 units for month 1, 2, and 3. But then I was like, oh, the milligram per mil, it's different. But they're doing that to keep it easy for
Yep.
them. So and I love that. So I think they've thought of so much to make it, user friendly for the patient.
Yeah, and I love that. And two, I do want to mention we have a lot of healthcare providers that are with the company. We also have a even larger amount of people who are not in healthcare and have no medical background too, that are able to get their link, share their story. So you can do this with a ton of background and education, and use your degree in that way to educate and support people on their journey. But there, if you are tuning in and you're just curious and you're not in the healthcare field, it's also great for you too. I mean, my younger sister and my mother just joined because they both have incredible peptide journeys. They've seen my journey with it, and they wanted to also get involved too. So it's really open to anybody. So if nobody else has any more questions, I will wrap it up. Thank you for hopping on. Definitely get in touch with whoever got in contact with you, and sent you either this replay or this link, and reach out to them with any questions, or if you're ready to join us. It's very easy to get enrolled. You just use the website. It's $79 one time, and that's $5 a month for your link. So it's very low overhead compared to opening up your own like peptide wellness practice yourself. And it's great. Did you guys have anything else to add? Annette, Angela, Megan?
no, thank you, everyone. Thank
All
you for
right,
coming.
cool. Thank you so much, everyone. We will
Thank
see you.
you.
And please get in touch if you have any questions too.
Yeah.
Bye, everyone.
Bye-bye.